Kathy has gorgeous legs, great looking legs, great shape and everything. She had just a few spider veins when we saw her a couple years ago, you know, that were bothering her. And when we originally treated those, she had some hyperpigmentation, which is a fancy medical term for after we treated her veins, we got a little bit of a dark brown discoloration over the area, which sometimes happens. It's the blood that leaks out of the veins, and the iron in the blood stains the skin and makes a little, you know, an ugly tattoo, an ugly little brown tattoo. 99% of this pigmentation is gone within 12 months, but you know, that's a long time when you're trying to make people look better. There are some various ways to get rid of that quicker, but we're not going to get into that right now. But anyway, Kathy's what we call washing a clean car in the vein business. She already looks darn good, has a few bothersome spider veins, but not a whole lot. And so the expectation level is going to be higher in that patient, you know, because they already look great, but they just have a few little minor things. So we got to be very, very particular about what we do and so on. So anyway, she had some pigmentation, and then she's also got a little problem area where once we treat veins, they'll go away. A lot of people think the spider veins come back, but generally it's spider veins in the vicinity of the area that are coming back.
Yeah, it was up here where I had it put.
Yeah, and I'm happy to say I can't tell where that pigment is anymore. And so another thing, just as a sidebar, is here at the women's group where they have 100 women employees, and I've treated a lot of them as I've had the special experience of seeing my patients 2 hours after I treat them, the next day, the day after that. Generally with patients, you're treating them and you're not seeing them for several weeks and so on. So I've gotten, you know, blow-by-blow feedback about everything we do, which has been very educational, interesting. But anyway, spider veins, when we do treat them, they look worse for, they look better because we're inflaming them and then they scar up and go away. So they always look worse for, they look better. But anyway, she's just got a few cosmetically disturbing spider veins, and there's generally liquid sclerotherapy is the FDA-approved treatment. When we mix liquid with a little room air, it makes a foam, and this foam, we generally treat varicose veins as big as my thumb and pinky here with foam, but probably 95% of our patients these days we're using foam sclerotherapy for spider veins, and we use a very, very dilute amount of the liquid, and this foam is just, it's very powerful. We can treat more spider veins with less needle sticks more effectively, in my opinion. And so what might take 6 sessions of liquid spider vein sclerotherapy will take us 2 to 3 sessions with foam. Now, some people might say, well, that's a bad business decision, Dr. Pittman. But what we're about here at Vein911 is patient satisfaction. The best business decision I make is we're treating the whole team. We're treating one patient at a time. We're looking for 100% patient satisfaction, and we consider everybody our walking advertisement. So if we get pigmentation and other, you know, less desirable things, we take those personally, especially when they're people we know real well, like Kathy. so we do have a little bit of pride, but anyways, so we can treat a lot more spider veins more effectively with less sessions and less costly, quite frankly. So anyway, this is what I call the Nutty Professor glasses, or probably more accurately, the Rick Moranis Honey, I Shrunk the Kids glasses. But as I mentioned earlier, you cannot do the best possible spider vein sclerotherapy without a device like this. It's my opinion, but anyone doing sclerotherapy without an aid like this is not doing the best possible job. That's my opinion. These glasses, and I don't work for this company, they don't pay me a dime, but they not only have magnification, but they have a high intensity light. But more important than both of those two things is the polarization. And I often, when I have time, I'll put these on patients just to show them. But it's like a black light. These spider veins just pop out, and in fact, I can see spider veins that the patient can't even see. And so it just makes the treatment that much more effective. So anyway, Amber, my incredible physician's assistant, she's frankly amazing, but then she was trained by the best. She does very good work. Anyway, she is preparing the foam, and we want that foam to be as fresh as possible when we do it. And so what we're going to do is we're going to find kind of the straightest, largest spider vein to treat initially. And these things are just barely under the skin, and I'm injecting very, very gently. And it's a lot like an Etch-a-Sketch for those old-fashioned folks like myself. You know, for about a minute, these spider veins are going to completely disappear because we've replaced them with liquid or foam. And so that's what we call at Vein911 the preview of coming attractions. Now, in about a minute, the blood, a little bit of blood's going to seep back in there, and you're going to see they're going to get pink in here. And that's a good sign. That means we've inflamed the spider vein wall, and it's going to scar up and go away. That's how we know we're being effective. But it never gets old treating these things because it's just so fun to inject them and watch that preview of coming attractions. And I would say the vast majority of our patients watch us do this, proving that it is not very painful at all. And frankly, I like the patients to see what we're doing, because seeing's believing. You're usually hearing oohs and ahs and that kind of thing, because it is pretty cool to watch these things just disappear before our eyes. Spider veins in this area are very common in the ladies. I'm not quite sure why. We should agitate a little more. Yep. Not quite sure why. There's no scientific evidence that crossing the legs causes spider veins, but my opinion is it probably is a contribution, because we tend to see spider veins anywhere there's friction on the skin. We need a little more alcohol wipes there. Anywhere there's friction on the skin. Okay, we'll get those. And so I think there's probably some relation, but you know, are you going to prevent spider veins by not crossing your leg? No, I don't think so. So I wouldn't stop crossing legs just because you think it might save you from spider veins. A little easier to get into. And so, you know, certainly visual sclerotherapy is an art. You know, sure, there's a science to it, but I guess like most things in medicine, there's no substitute for experience, and you just have to do a lot of it before you're going to get good at it. But that reminds me of something my mentor told, one of his favorite sayings 20 years ago, and that is, some people have 20 years of experience, some people have 1 year of experience 20 times over. So anyway, and he was right about that. But anyway, I would not shop sclerotherapy on price. I think that's a huge mistake. You know, and I would certainly shop it on value, experience of the practitioner outfit that you're going to. It's almost legend to hear people say, oh, I had that spider veins treated and they never went away, or they came back, or whatever. Anyway, again, you've got a little reticular coming into this area, but we're not going to do any more than that. Kathy has a spider vein here. She felt like it might be a bruise. How do we tell the difference between a spider vein and a bruise? Well, it's pretty easy. When I go to press on this bruise, okay, and then I lift up, it's not, see, I'm holding the skin taut, it's not there. When I let go, it fills in. That's a spider vein. If it were a bruise, it wouldn't change. So again, I'm just pressing on it, and I'm basically pressing the blood out of the spider veins. And that's what I would call a preview of coming attractions. But when I let go, it fills in. And so it's filling in. This is very definitely a spider vein. She's also got a few down here, and we can tell that by just pressing on it. But this, you know, a more intense patch like that is going to take more than one session generally to get rid of. In fact, almost every spider vein treatment needs more than one session. Anyone who says you're going to get rid of your spider veins in one session, I don't think that's happening. Kathy's leg's like a masterpiece canvas. It takes several coats of paint to make that look good. So an average spider vein case is going to take 3 30-minute sessions, and by the third session we're generally searching for spider veins to give everyone out there a thermostat on how effective it is. So for an average case, 3 30-minute sessions spaced out by a few weeks, and we're going to be searching for them. But almost no one's going to get away with just one session of spider vein sclerotherapy, especially in more intense areas like this. We're ready. So anyway, maybe, not really. So a little more tender down by the ankles, but a few more alcohols. Can I tell you another story? I got 2 daughters and identical twin boys, and a few years back when my daughters were 6 and 8, my wife's combing their hair, they're crying, and she says, "It's got to hurt to be pretty." And I'm still shell-shocked over that. I'm like, oh my God, what do you tell my daughters? But she's right. What I've learned in the vein care business, vein care treatment, is the prettiest ladies put up with the most pain. There's definitely a correlation. Definitely a correlation. Anyways, no. Do whatever you need. Just make me look better. So what I'm doing, I'm kind of pressing this. Okay, I'm gonna tease now. I'm pressing this bruise out, but no, I'm pressing the spider vein because I want to see where its primary, where the body of this spider is and where it starts, and I want to try to be as close to that area as possible. So in this area, you want to be careful of arteries and other important things in the area. We've seen spider veins on the backs of former cheerleaders. Anywhere there's friction. We treated a football player who had bad spider veins in this area related to helmet trauma years ago. And so Kathy's describing this coming up after some trauma, and I can feel a little calcification in there. But that's not uncommon. We've treated some children. I remember one hit his face, 7-year-old hit his face on a pool and developed a spider vein in the face, and we can get rid of that, not with injection sclerotherapy, but with our Vein Go device, ohmic thermolysis. Extraordinarily effective for that. But areas of trauma, not uncommon to develop spider vein there.